The rates of sexually transmitted infections, or STIs, are high amongst young people in Australia. This presentation focuses on the 15 to 29-year-old age group. Rates of infection are disproportionately higher in remote and rural communities. Sexually transmitted infections can be viral, bacterial, or parasitic in origin. In relation to viruses, the notification rate of HIV has steadily increased in the Aboriginal and Torres Strait Islander population, while declining in the non-Indigenous population. Hepatitis A and B can be transmitted sexually. A vaccine is available for both. Only 2% of cases of Hep C are sexually transmitted. With the human papillomavirus, there has been a significant decrease in genital warts in the under-30s age group since the introduction of the HPV vaccine. Herpes is extremely common, with 75 out of every 100 Australian adults having HSV1 and 12 in every 100 having HSV2. Both can cause cold sores and genital herpes. Now on to bacterial STIs. Chlamydia is the most common STI in Australia. More than 80% of infections occur in people under the age of 29. If you look at the graph of notification rates of STIs, since 1999, the rate of chlamydia has increased exponentially. Gonorrhea and chlamydia are often symptomless. If left untreated, they can cause infertility in women, as can Mycoplasma genitalium, which is an emerging STI. Syphilis was all but eradicated until recently. However, the rate of infection continues to increase, with the highest rate of diagnosis in those aged 15 to 29. Now rounding up with parasitic STIs. Trichomoniasis is caused by a single-cell protozoa. Infection rates are higher in remote and rural areas. Pubic lice infect pubic hair. While irritating, they can be easily treated with topical creams. Risky sexual behaviour is linked to an increased rate of sexually transmitted infections. Such behaviour includes multiple sexual partners and infrequent condom use. Research shows that the social determinants of risky sexual behaviour in young people include poverty, exposure to community violence, frequent drug and alcohol use, peer delinquency, a lack of parental supervision, and disengagement from school. Research in regional and remote communities in Australia has shown that although STI infection rates are alarmingly high, STI infection is generally seen as something that happens to other people outside of their community. There is also great stigma and vilification around being diagnosed with an STI. This leads to reluctance to visit health clinics and get a checkup. A study on barriers to young people accessing reliable sexual health education concluded society, peers, their environment, and family can be an issue. On an individual level, high self-esteem played a big role in seeking sexual health knowledge and applying it, while low self-esteem was identified as a key perceived predictor of risky sexual behaviour. I will compare and evaluate two sexual health behaviour change initiatives in Australia, these being the Caddyshack Project and Sexual Health Out and About's Be Proud of Your Choices campaign. The Caddyshack project focuses on youth sexual health in the Illawarra region of New South Wales. They have a website, blog, online newsletter, webinars, social media, and work in partnership with individuals and other organisations. Projects include outreach chlamydia screening, free sexual health resources, sexual health and relationship kits, and free condom dispenser sites. Being able to work directly with youth through the organisations they are a part of is a strength, as is free, respectful, sex-positive and inclusive sexual health training, ease of access to condoms, and free chlamydia screening. This helps to overcome some of the barriers to behaviour change, such as stigma, low self-esteem, peer pressure, as well as family and community attitudes. While the programs don't directly address the social determinants of health related to risky sexual behaviour, they aim to reduce STI infection rates through free condom access, chlamydia screening and education. The Be Proud of Your Choices campaign is targeted at young people living in rural and regional Victoria. The aim of the campaign is to deliver a positive message to young people about taking care of their sexual health and educating about contraception, privacy and their options. The delivery of the program relies on young people reading posters that are placed primarily in rural shopping centres. The posters contain links to Facebook and Instagram pages that contain 6 short YouTube videos. The success of the campaign is reliant on young people reading and looking up links on posters in a public space. This doesn't consider barriers to behaviour change such as stigma, peer influence and community attitudes. None of the social determinants of health relating to risky sexual behaviour have been addressed. While informative, the presentation and graphics of the video might not appeal to the target segment. It comes off as being a bit cheesy and more appropriate for a younger audience. In conclusion, of the 2 approaches, I perceive the Caddyshack project would have a greater chance of affecting positive behaviour change in relation to youth sexual health. It is fair to say that neither approach directly addresses the social determinants of health related to risky sexual behaviour, but the Caddyshack project does offer practical interventions to minimise STI transmission. Thank you for listening to my presentation.